My name is Jasmin Henry, and today I'm going to be talking to you about venipuncture and what you can expect during this simple procedure. So according to PubMed, venipuncture is the most common invasive medical procedure performed by healthcare providers. Venipuncture is simply just perforation of the vein for the purpose of taking blood, whether it be for a study or for a smear. Generally it's to find something out, make sure everything is normal. A lot of people don't understand blood draws and the procedures that are involved in this, so they tend to get annoyed, specifically by things like fasting and all that stuff. And I've been doing this for a while now. I was an Army medic for about 4 years. I ran sick call and I ran the treatment room, and I was a subject matter expert for IVs and blood draws in my clinic. So most people have no idea what they're looking at as far as the procedure goes when they are the patient, so they have no idea if the phlebotomist or the tech is doing a good job, if they're doing it right, and that tends to give people a lot of anxiety on top of already being afraid of needles or medical settings. It can be very unsettling when you don't know what's happening. And I don't remember the last time a tech walked me through the procedure, but I already know what's supposed to go on. I can only imagine other people that have no idea. They just have to trust the person that's sticking them, and to me that's just scary. So that leads to a lot of anxiety, and so I believe that maybe understanding the procedure a little bit better could lead to more cooperation on parts of the patient. So it's important to get educated and also to know what you can expect before, during, and after the procedure. Such as fasting, as I mentioned before. Sometimes you have to fast from 8 to 12 hours. That is because food and stuff like that can affect your levels of glucose, cholesterol, and certain things that are being tested for. According to Quest Diagnostics website, nutrients and ingredients in the food and beverages you consume are absorbed into your bloodstream and could impact factors measured by certain tests. Fasting improves the accuracy of those tests. So this is why we ask some patients sometimes to fast anywhere from 8 to 12 hours. This means that it's actually easiest to schedule your blood draws in the morning. That way, if you fast at night, you can just sleep through the fasting, and then you wake up, you go first thing in the morning, you get it done, and then you go have breakfast. According to William Cornell's MD of Harvard, you should not eat for 8 hours before having your glucose measured. Doctors measure triglycerides, cholesterol, and all that after a fast of 10 to 12 hours. Unless you're instructed otherwise, you should take your meds, and water is highly encouraged because it helps your veins pop up. If you're dehydrated, it's very hard to find them, could lead to painful sticks. And then now we move on to the procedure. When you walk into the lab, they should ask you for your name and date of birth. These are called patient identifiers to make sure that you are the right patient and that is the right procedure that is being done to you. And now I do have a demonstration for you guys. Okay, now that you're all done with your blood draw, it's time to talk about after effects. There are some small side effects to having your blood drawn, such as bruising, some tenderness, your arm might hurt a little bit, It's good to keep the bandage on called Coban. It's a self-adhering bandage. You keep it on for about 2 to 4 hours, helps minimize bruising. You should also probably take it easy on that arm, no heavy lifting or contact sports, anything like that. However, you should call the ER if you notice any pain or numbness that is excessive in that hand, um, excessive bleeding or bruising, and you are on blood thinners. Definitely go to the ER. According to PubMed, minor bruising and hematoma were fairly common in involving 12.3 of venipuncture, with minor bruising being the most common reaction. Serious complications were observed in 3.4 patients. Diaphoresis, which is sweating, with hypotension, which is low blood pressure, occurred in 2.6%. Syncope, which is fainting, occurred in less than 1% of patients. There were no serious local reactions such as cellulitis or phlebitis observed in this study. So, understanding procedures that are happening to you is important because it gives the patient a little more control over what's going on. They may not be able to stop what's happening because blood draws are usually a necessary thing, but it gives them a little more comfort to know that what they're looking at, they're looking at it and they're saying, okay, this is going right, and by all means, if you see somebody doing the wrong thing or something that you're not comfortable with, ask for clarification, tell them to stop, ask for another phlebotomist. There's nothing wrong with that. A patient, you have rights. This also, knowing what's going on, helps patients feel less annoyed because a lot of the times they feel like maybe we're just being mean and we want them to starve because I guess it gives us kicks or something. Really, we don't want to starve you. It makes you cranky. We don't want you to be cranky when you come to us. Because you'll understand and you'll be more willing to cooperate with the procedures and such that we have in place, which all in all leads to shorter procedure times. So all in all, you're in and out faster, you have a better time, and you can go have your big breakfast and be done with it.